Hi, I'm Dr. Emily Jungheim. I am a physician in reproductive endocrinology and infertility at Northwestern Medicine. More recently, what the recommendations are to really look at the local infection rate and resources to determine what makes sense in your area. Here at Northwestern Medicine, we have resumed fertility treatments, but we're doing it in a way to keep our staff and our patients safe from infection as they go through treatment. At Northwestern Medicine, what our approach has been to watch the patient for symptoms and to determine when it's safe to come back based on where they are in the cycle and what their treatment protocol is. In regards to getting pregnant after testing positive for COVID, in general with our fertility patients, what we're asking them to do is to wait until their next cycle and to make certain that they're symptom-free. All of our new patient consults are being seen via telehealth, and quite a few of our follow-up patients are being seen via telehealth as well. What it's allowed is much better access for our patients to get appointments in a timely fashion and not have to rearrange things and juggle things that they would normally have to navigate to get the care that they need. Many of our patients had to delay transfers of embryos that were being cultured during COVID or transfer of oocytes that were frozen during the time of COVID. The good news is that we've resumed transfers and are excited for people to get pregnant again. In our center, we are very fortunate in that we have a large lab and great patient flow. So patients who were delayed we're caught up with that in terms of transfers. A lot of the focus in fertility has been on women, but it's also important to think about men and how COVID-19 may impact their fertility. For better or worse, there's not a whole lot we know about COVID-19 and male fertility. Some folks have been looking for viral particles in sperm, but what we do know is that high fevers can impact sperm quality, counts, and motility. So it's just important to keep that in mind in terms of whether or not a man has had COVID-19 and high fevers, and just being cognizant of that as they may be resuming care as well. Fertility treatments and infertility can be stressful for anyone, even under the best of circumstances. Now you add COVID-19 on top of it and all of the things that people are struggling with in regards to that, it can make it even more difficult. We're quite fortunate at the Center for Fertility and Reproductive Medicine in that we have 3 health psychologists who work with us every day to help patients navigate their treatments and do it in a way that they feel strong. Our health psychologists have been really focused on COVID-19 and have been doing everything they can at this time to get patients to safely navigate that as well. There's a lot we don't know about COVID-19 infection and pregnancy and how it may impact the fetus. We do counseling for our patients before they initiate fertility treatment, trying to address all of their concerns before they proceed with treatment. But certainly once you're actually pregnant, that concern can become even more heightened. What we've been telling patients is to do their best at avoiding infection, just as everyone else would. Social distancing, masking, hand sanitizer, etc. And our goal is to just keep anybody from getting infected at baseline. At Northwestern Medicine, what we found that works is to continually revisit all of the recommendations from the CDC, our local health department, our health system, and most importantly, within fertility, the American Society for Reproductive Medicine. Continually reviewing their guidelines, any information that they release, and updating our protocols and practice has been really important for keeping things safe, keeping our staff reassured, and making patients feel strong about moving forward with treatment.